Hello, dear friends. This is Sofya Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. Today, I would like to discuss the problem of headaches. That's the first thing. Second, I would like to talk about, discuss some of the causes of headaches and how to deal with them. I would also like to strongly emphasize that if you are suffering from a persistent headache, the single most effective and correct way to deal with it is to properly identify its underlying root cause. It is absolutely unacceptable to simply take painkillers if you have a headache. Making this your rule for dealing with the problem is not right because in the end result of taking painkillers is not good. Your condition will get worse. Your body can get used to painkillers, and overall the situation will slowly keep getting worse and worse. So there's no way around it. If you want to maintain your health, you need to find out the cause of your headache. Of course, it's the right thing to do this together with your doctor so they can help you and order the necessary tests. But today I want to discuss with you just a few simple points that you can check for yourself and address in order to cope. So I'll say right away that headaches are one of the most complicated topics, and the primary objective of this approach is to make the headache much more manageable and tolerable, so that it does not negatively affect your ability to perform your daily professional duties. And ultimately, if you find the underlying cause of your headache and take proactive steps to consistently address it, then eventually the headache will go away entirely. It may happen that the headache goes away quickly, but never underestimate it if the headache doesn't disappear completely but becomes tolerable. So if after addressing it your headache becomes tolerable, please endure it and do not start taking painkillers. Let me say a couple more things. Now, as Minister of Health Skvortsova has announced, medicine should become patient-oriented. To be honest, I don't really understand what patient-oriented medicine means. But apparently it means that the patient should always be satisfied. But in reality, the goal of medicine is to restore a person's ability to work. So let this always be your criterion. If you can tolerate a headache and still maintain your ability to work, then that is the solution and you should continue to use it. That is, don't think that the solution we'll discuss today, yes, sometimes the headache goes away very quickly. Sometimes it takes several hours. Sometimes, for example, during the climacteric period in women, right? She gets a headache and it just hurts. Sometimes it happens that the pain decreases over 2 or 3 days, but during this time it becomes bearable. It's good if it's bearable. In that case, try to endure it and please refrain from taking painkillers, because in the end you will still see the harmful effects of constantly taking painkillers. You will still want to stop taking them eventually. It will be harder to do this because the pain will last longer, and eventually there will still come a moment when you have to endure it. So believe me, it's better to endure it before you start taking painkillers than after, when a certain dependence on them has already developed. So one of the reasons that I just wrote down, which you can figure out yourself and is quite easy to resolve. The first cause of a headache is hunger. Why? Because when the level of protein in the bloodstream drops, the tissues start to swell and fluid moves into the tissues. If we take the extreme case, after all, everything in life basically happens on a gradient, right? If we take the extreme degree, the most severe manifestation of this condition, it's when a person develops ascites from hunger, from protein deficiency. That is, fluid accumulates, for example, in the abdominal cavity, right? So we see that there is a certain kind of removal of fluid from the bloodstream. So every condition has a certain gradient. And if we take the smallest gradient, when a person is hungry, they get a headache because a certain swelling of the tissues occurs, including in the brain. The person has a headache. And people who are on diets, on protein-free diets, just eating herbs and things like that, right? They think that if they have a headache, it's just their body detoxifying. That's not true at all. If you don't eat animal protein as you should, your head hurts simply because your brain tissues are swelling. The solution here is to eat. Let me say right away that if you start eating, the headache will dull, it will become less intense, but it might not go away immediately. It can last for several hours because you have to understand that the body needs time to resolve this problem. In other words, the body has its own time frame for dealing with this situation. So the first cause of headache is hunger, specifically protein hunger. The second cause is a mild degree of hyponatremia. You might experience this cause if you go to a sauna, you steam yourself there and you don't drink mineral-containing beverages in the sauna, such as Essentuki water or just salted water, or you don't take salt tablets, or there are tablets called plasma, right? Then you might recall that if you've been steaming in the sauna for some time, an hour and a half, 2 or 3 hours, you come out with a headache. So this headache is caused by a decrease in sodium levels in the bloodstream, a certain degree of hyponatremia. What should you do in this situation? Here, you should either drink some salted water or eat some pickles or drink some salty brine, like cucumber brine. Again, I can say that if you are hungry, sometimes just eating protein food is not enough. It just so happens that hunger from experience is accompanied by this hyponatremia. That's why you need not just to eat, but to add a little more salt to your food. That is, this combination can occur, especially if you haven't eaten, you've had a very active day, you've sweated a lot, and salts have left your body with the sweat. In that case, you need to take both of these reasons into account. And for those who go to the sauna, please always take salt with you, or salty drinks, or pickles. So resolve this situation and then you won't have a headache after the sauna. Next, there is a vitamin called niacin, or vitamin B3. This is the very vitamin that, when a person takes it, after a while can cause redness of the body, and even a certain itchiness may occur. In other words, this vitamin dilates peripheral blood vessels. And if, for example, your headache is, as you know, related to increased intracranial or intraocular pressure, you can use this effect of vitamin B3 and take it. There are tablets of 50 milligrams and there are tablets of 100 milligrams. But in principle, if you take a tablet, say 50 milligrams or even 25 milligrams, if you split it in half, then basically you can use this effect of vitamin B3 to dilate the blood vessels in the body and thereby lower the pressure. I want to make a note right away that sometimes vitamin B3 can actually cause a headache precisely because it dilates the blood vessels in the brain. But the vessels affected include those in the brain, and the pain there is a bit different. It's definitely tolerable. It's a kind of dull pain. So it's never sharp, it feels more like a heaviness in the head. And to be honest, if you experience this, I would recommend that you continue taking vitamin B3. If it's too uncomfortable for you, maybe lower the dose, split the tablet in half, because this could be one of the signs of a vitamin B3 deficiency in your body. And this is a very, very important vitamin, extremely important. A lot in our body depends on it. It is responsible for the proper functioning of the gastrointestinal tract, for intelligence, and so on. So from experience, I can say, use this effect of niacin, especially if you know you have vascular spasms. It works wonderfully. At the very least, it is safe. It is absolutely safe. If we're talking about any special substances, then niacin and analgin shouldn't even be mentioned in the same breath. That is, it's not just safe, it's actually beneficial for the body. And the last thing from the simple causes you can address is overstimulation, as I called it. Overstimulation from gadgets. Again, this is based on experience, even the experience of people we work with. Someone has a headache that just won't go away. It just doesn't go away. And this person tried an experiment. They turned off their computers, phones, TVs, and yes, just reduced their interactions with people to the bare minimum. They spent the whole day without a headache at all. Please remember that all these electronic devices, TVs, computers, phones, tablets, all these things, what are they called? Players that you stick in your ears so you're constantly listening to music, constantly stimulating your auditory nerves. This can be a cause of headaches. Please make sure to follow a routine here. Maintain a proper balance between work and rest, I would say. Turn off absolutely all your electronic devices, all of these gadgets 2 hours before bedtime. Go for a walk. On weekends, don't go near your computer, don't watch TV, don't turn off all your phones, social media, and so on. Just switch everything off and give yourself some quiet time. It's even better if you go out into nature, visit a park, and just sit in a calm, peaceful environment. So, this is one of the important causes of headaches, informational overstimulation, and it shouldn't be overlooked. And finally, again, you need to find the cause together with your doctor. You need to identify the cause of your headache because it is often the beginning of a tumor process which cannot yet, well, with a neurological examination, it can't be determined so quickly. But it all starts with a persistent headache, accompanied by feelings of nausea, a deeply depressed and tearful mood, and a sense of overwhelming fatigue. So it is vital to work closely together with your medical doctors, and only by accurately identifying the underlying cause of your headache and properly addressing it, will you not only get rid of such an incredibly unpleasant situation as a chronic headache, but also successfully preserve your long-term health. I hope that you found the information in this video to be very helpful. I sincerely wish you a long life of good health, and I truly hope that you always treat your body with the utmost care and respect. And strive, of course, to work closely together with your doctors and make sure to never ignore the recommendations they give you. But at the same time, always try your best to maintain a healthy lifestyle. And that means having a sensible, reasonable perspective on your condition and sensibly resolving those situations that you are able to resolve. At the very least, if you have a headache from hunger, then please do not let that situation continue any further. Please return to a normal diet. Start eating meat. And moreover, I'll say that if you've already started having headaches, then eating 3 times a day is no longer an option for you. You already need to eat more frequently. That is, your body has to some extent exhausted its resources, and now you basically have to, so to speak, tow it along. Well, I wish you all the best. I wish you good health. This was Sofya Dorinskaya with you. All the best.